Hello guys, one more time here, Dr. Aguilar from Texas Integrative Medicine and Cardiology, talking to you about a very important topic. This time we're going to discuss vascular aging, which means the age of your arteries. Many physicians in the past have said that a man or a woman are as old as the age of their arteries, in which case, if you're 40 or 50, that doesn't mean that your arteries need to be 40 or 50 or that they are 40 or 50. They may actually be 60, 70, or 80. There's ways to check the arterial age, which will tell us how healthy they are. But for the most part, aging comes from an inflammation process. And even eating any kind of food is inflammatory. But that's an inflammation that happens acutely, meaning right away, and our body has a way to get the inflammation treated and resolved. We consider that's a positive inflammation. If I were to cut my hand with a knife, then I'll get bleeding, I'll get inflammation from the trauma itself, which will attract a lot of cells into the site, cells that are going to be trying to heal the process. If I don't do anything about it, it'll get healed in about 10 days, 15 days, or whatever it takes, depending on the size of the injury. If it's too deep, I may need to go in the bleed, sort of like clean, and then suture it, so it'll go faster, but nonetheless, the healing process is driven by inflammation, which at that point is normal and is actually benign, it's protective. The problem is that inflammation can become permanent, always present, for multiple reasons that we discussed in the past when we talked about high blood pressure. But unhealthy foods, smoking, diabetes, high sugar, high insulin, high blood pressure, lack of good sleep, lack of resting, excessive stress, and many other things that I can tell you. Perhaps the list goes to 500 things. Those can be inflammatory, and if, for example, you feel tired one day, or most days, you have joint pains on and off, that's a sign that you have inflammation. When this inflammation doesn't go away, then it becomes quite negative, and that makes the process of aging going faster. We're talking about the vessels, in this case the arteries, but the aging comes all over the body. Now, how can we try to help the process? Very simply, we just need to assess what is making you aging faster, which is taking simple blood, saliva, maybe urine testing, find out where you are, and give you what you need to try to help the process. It always starts with a healthy nutrition, which is very simple to do. And then after that, depends on your needs, we can customize your needs to give you exactly what you need. We always talk about 5 pillars of health: nutrition, exercise, which doesn't need to be a whole lot, supplementation depends on your own needs, mind, sleeping well, resting, maybe meditating, but the most important thing is dealing with stress in a good way. We can always also measure stress. And medication. I am a physician, and even though I'm functional medicine, I'm also the classic traditional cardiologist that has a huge armamentum of medications that sometimes are needed, like for example metformin, or other medications that are quite beneficial, like statins, that sometimes may be needed. In any case, if you are interested in checking your vascular aging, let us know. We'll be happy to see you going through the process, and most importantly, do something about it and get you younger. Until next time, have a wonderful day.